Hey, my name is Lexi. I'm going to be your student nurse today, and I'm going to be doing a head, eyes, ears, nose, and throat assessment on you, okay? It's going to be pretty long. Is that okay?
Yeah.
All right, and could you tell me your full name, date of birth?
Kendra Haskins, 9/20/91.
All right, thank you. I'm going to go get some hand sanitizer real quick and some gloves for this one.
Okay.
I'm going to pull this curtain, give us some privacy real quick. All right, and so first I'm going to inspect your head and note that it is symmetrical, it is round, and it is midline and proportionate to your body. And I'm just going to palpate your skull, okay? All right. I'm not feeling any deformities or depressions, lumps or masses, lesions. Head is normocephalic, and did you feel any tenderness with that at all?
I did not.
Okay, good. All right. So no tenderness with palpation of your skull. And I'm going to palpate your temporal arteries. All right. Your temporal arteries are palpable and strong, with a 2+ rating, which means good strong pulse. Now I'm going to assess your temporomandibular joint, okay? Would you open and close your mouth for me? Okay. All right, there's no clicking heard or felt with that, and you seem to have good full range of motion with that joint, so that's perfect. And now I'm going to inspect your face and note that your facial features are symmetric, your facial expression is calm and relaxed, your skin is even and consistent, the texture smooth. I don't see any edema or involuntary movements, and no visible pulsations there. And so I don't see any lesions on your face either. And so now I'm just going to inspect your neck. If you could look up a little bit for me. All right, your trachea is midline with symmetric space, equal space on both sides of it. Your sternomastoid muscle appears symmetric bilaterally. I don't see any visible enlargement of the thyroid gland, just overtly by looking at it. And can you swallow for me real quick? All right, your thyroid and cricoid cartilage move up and back down with the swallowing motion. And I don't see any lesions or edema in your neck at all. Okay, now I'm just gonna palpate your trachea, okay? Palpate on your neck a little. All right, palpate on either side of it. All right, your trachea is midline, and I feel equal space on both sides. And I don't feel any swelling in your neck area. So I'm gonna go behind you and palpate your thyroid, okay? Okay. Now, I'm gonna put my fingers right here on either side of your thyroid cartilage. You could lean your head a little bit to the right for me. I'm going to push on your thyroid. Can you swallow for me? Okay, do the same thing on the left. All right. Your thyroid gland was not palpable, which indicates no enlargement, which is perfect. And I'm going to auscultate and listen to your thyroid, okay? Okay, I don't hear any like swooshing sounds, so that indicates that there's no bruit present, which is perfect. And so now I'm going to palpate your lymph nodes, okay? All right, first I'm going to start with the preauricular, the posterior auricular, the occipital, submental, right here, then submandibular, jugulogastric, superficial cervical, the deep cervical chain, posterior cervical, and your supraclavicular right here, okay? Okay, not all of them are palpable, but any of them that were palpable they were movable, discreet, and soft. And did you feel any pain with any of that?
Mm-hmm.
So they are also non-tender, which is perfect. So now we are going to go to this eye chart out here. And if you'll just follow me, we're going to test your visual acuity. And if you would just go stand on that X back there at the 20 feet mark. So the patient is at 20 feet. Do you wear glasses or contacts?
Yes.
Which one?
But
Okay.
contacts right now.
Do you have your contacts in? Okay. Yeah? You don't?
Mm-mm.
Do you need your glasses for this?
No.
Okay. Are you sure? Okay. So patient states that she wears glasses or contacts, but she's not going to wear them for the test, okay?
I can see without them. It's just blurry.
Okay. All right. I'm going to go down here to this chart. And could you read the smallest line that you can see for me?
Number 6, EDFCZP.
Okay. Do you think you could try the next line down?
Yeah. FELOPZD.
All right. You think you can do the next one or no?
No.
Okay. All right. This we're gonna do it with each eye. Okay. Can you cover one eye and read the smallest line you can?
7 again. FELOPZD.
Okay. Next line or no?
No.
Okay. Now do the other eye.
7 FELOPZD.
Okay. Do you think you could do the next line?
No.
Okay. All right. So this indicates that you have 20/25 vision. So that means that at 20 feet where you're standing is you read what the average eye can read from 25 feet. So it's slightly off, but you also stated that you didn't have your glasses or contacts with us. So we're going to go back to the room here. And so now I am going to continue your eye assessment, and I'm going to inspect your external eye. And I'm going to first note that they're aligned symmetrically on your face and in your skull, and there's no protrusion or bulging noted. They're not sunken in at all. And I'm going to note that the palpebral fissures are equal bilaterally. Could you blink for me? All right. The upper and lower lids do touch when they meet upon blinking, and the eyebrows and eyelashes appear full with no hair loss, and the top eyelid does cover part of the iris. And now I'm going to look. Sorry. Now we're going to do a confrontation test, okay? All right, I apologize. So I'm going to have you cover your right eye for me, and I need you to tell me when you see my finger, okay? Now, perfect. I'm going to come from above. Let me know when you see my finger. Now, perfect. I'm going to come from below.
Now.
Perfect. Now we're going to do the other eye. All right, let me know when you see my finger.
No.
Okay. Now from the top.
No.
Okay. We're going to go from bottom.
No.
Perfect. All right. That tested your peripheral vision. Your peripheral vision is intact from all angles. And so now we're going to do the 6 cardinal fields of gaze, and that's going to test the muscle function of each of the 6 muscles that moves your eye. So if you could just look straight and don't move your head at all, and just follow my finger with your eyes, okay? Alright, perfect. Your muscle function for that is intact. And now I'm going to do your cordial light reflex, okay? This is just where I'm gonna hold this about 12 inches from your face and shine on the bridge of your nose, and the light should reflect at the same place on both of your eyes, okay? Alright, perfect. And it reflects at the same place on both eyes.